People shouldn't be nervous. People should be ready. People should get educated.
Not panicked, but prepared. That is the advice from local leaders now that coronavirus has reached us here in Northeast Ohio. 3 people in Cuyahoga County have tested positive for the virus.
And tonight we're helping you understand what that means for you and your family. We've got a team of reporters working to find answers for you tonight, and we're going to start with Olivia Fecto. So Olivia, we now know where one of those patients works.
Yeah, good evening, Danita. The Jewish Education Center here in Cleveland Heights says it will close its office for 2 weeks after one of its employees contracted coronavirus. The Cuyahoga County Board of Health says 2 patients were exposed to COVID-19 while traveling in Egypt, the other at the American-Israel Committee Conference in Washington, D.C.
People need to know that these people were already on the radar of our public health departments, and this is why they were under quarantine already.
Now, those 3 people are self-isolating at home after showing symptoms. They are not in the hospital. Late Monday night, the Jewish Federation of Cleveland confirmed one of those 3 is an employee at the Jewish Education Center in Cleveland Heights. The Education Center's offices will be closed for 2 weeks. 6 people with whom the 3 patients came into close contact are self-quarantining now, too. The city of Cleveland says public health leaders are working to keep communities safe.
This is a very dynamic situation across the world, not just the city of Cleveland. And so we are watching this very closely and working with our public health partners in the city, in the county, and the state to see what the threats will be to our communities.
According to the Cuyahoga County Board of Health, all 3 people live in Cuyahoga County, but outside the city of Cleveland. They range in age from 54 to 56. And while the state now has the ability to test people in its own laboratory, it currently has enough supplies to test just 300 to 400 people.
We really want to make sure that while we don't have a ton of testing capacity quite yet in the state of Ohio, we have some. We want it reserved for the sickest folks.
The state is also working with 2 commercial labs to test other potential cases of COVID-19. For now, health departments are limiting their monitoring to people with a travel history to level 2 and 3 countries.
As well as people who have a fever coupled with that travel history, or people who have unexplained severe respiratory illness without another cause like influenza or another illness that's common right this time of year.
And health leaders stress that 4 in 5 people will develop just mild symptoms. The biggest concern, of course, is for vulnerable groups, and that includes seniors, people with certain chronic illnesses, and those with compromised immunity. Reporting live in Cleveland Heights, Olivia Fecto, News 5.
Along with the announcement of 3 positive cases, Governor DeWine also declared a state of emergency in Ohio. So what does that actually mean? Well, basically, it allows the state to react to the outbreak more quickly. The state can now buy medical equipment or services without having to go through a lengthy bidding process. The Department of Health can create guidelines for diagnosis and treatment to distribute to healthcare providers. And if necessary, the state can issue guidelines to restrict work and travel.
And with the confirmation of coronavirus here in Northeast Ohio, just what is the next step for all of us? 5 on Your Side investigator Joe Paganakis spoke with the experts. All right, Joe, continued diligence with the hand washing and the surface disinfecting, that can't be stressed enough.
Rob, both the city of Cleveland and Cuyahoga County urging everyone to stay level-headed, not to panic, but be thorough in their precautions and continue to use information from the CDC and the Ohio Department of Health as the ultimate travel guide.
If we're sick, if we're coughing, if we're sneezing, if we have a fever, most importantly.
Local health experts outlining when you should consider contacting your healthcare provider in light of Monday's 3 confirmed cases of coronavirus here in Northeast Ohio, continuing to stress the preventative steps we must all practice every day.
We want people to cough into their elbow. We want people to cough into a tissue. We want people to stay home when they're sick.
Cuyahoga County Health Commissioner Terry Allen telling News 5, if confirmed coronavirus cases progress, consider working from home if you can. And if not, workplace hygiene is now even more crucial.
We want people to frequently clean surfaces and other frequently touched things like door handles, right? Or shared computer terminals and workstations.
We ask you not to panic.
And Cleveland's director of the Department of Public Health telling News 5 the city has taken comprehensive disinfecting measures at municipal buildings, Cleveland schools, universities, senior centers, social service organizations, and even the Board of Elections, with the Ohio primary coming up on March 17th.
We're making sure that they're sanitizing the frequently touched objects, which are the pens and the stylus.
And if you're heading to Hopkins International Airport,
we suggest that people take some of those matters in their own hands and have sanitation measures on them so they can wipe down seats and commonly touched surfaces.
And advice if you're planning that trip by air here in the continental U.S.
I would say that if you have chronic health problems and you're thinking about being in a high-risk environment, which would be a place where 10,000 people could sneeze on you, it might be something that you want to discuss with your healthcare provider.
And as of now, the CDC is not restricting continental flights. The CDC has recommended travelers avoid all cruise ship travel worldwide. You're encouraged to avoid any travel to China, Iran, Italy, and South Korea. And Rob, we have links to all of this information on our website and on the News 5.